Chapter 7, Interviewing, Counseling, and Clinical Communication. This chapter deals a lot with communication and your skills as a speech-language pathologist or as a clinician, and how you orally and verbally communicate. It's very important for you as an SLP to be a very clear and concise communicator, both verbally and in written format. One other item that I want to bring up, and this will go through a lot of all your written and verbal communication, is that you really need to strive to be objective rather than subjective. And I'll try and give you some examples of that. When you are being objective, you are stating exactly what you observe. So you will use words like, I observed that Johnny threw his cup. Now, that is very different than Johnny had a temper tantrum when he threw his cup. Just adding that in there, that having a temper tantrum, things like that, gives it more of a judgment. We're determining what he's doing. It's very important that when you are writing that you use very objective terms and that you state what happened, not what you think it happened or anything like that. Just simply state what occurred. And if you think of it in that way, you'll be much better off as a clinician. You'll be much better off when you write your reports, that you'll be stating exactly what occurred in a very objective manner rather than subjective and adding judgments and values to those things. So please remember that. Another thing I want to stress here, whether you work in a clinical setting, whether you work in a school setting, confidentiality is extremely important. And I think it's important for you to know that you may think, well, I'm talking to someone and they don't know where I work or they don't know that. It's really a small world. And when you think about 6 degrees of separation, usually within 6 events or people of knowing someone, even though we have just met, it will only take 6 people to hook us together to maybe know somebody that somebody else knows. So please remember that confidentiality, whether you're in the school setting or a medical setting, is extremely important. There are laws and rules. We have confidentiality rules in education. We have HIPAA in the medical community. So please remember, confidentiality is extremely important. Now, that doesn't mean that you can't talk with another colleague about a client you have. However, you don't need to disclose their name, their age, etc., name and personal identifying information. If you need to talk about that you have a 3-year-old that has autism and these are the things that he does, what have you used? You can have that conversation without going into names, dates, and history of family and all those sorts of things that provide specific, that might identify that individual. As we go on in communicating, I think it's very important. Part of communication is documentation. And I know I've mentioned documentation before, and you'll probably hear it again. Documentation is extremely important. Your progress documentation is important. Whether you use SOAP notes, whether you have your own way of documenting progress, whether you use a summary, whether you use some sort of progress note, whatever you might use, it is vitally important that you document the progress. Whether you are working in a school setting or a medical setting, you will need to be accountable for your client's progress, and that progress documentation will be your friend in those situations. The other time that you as an SLP will be providing written information will be things such as diagnostic reports, case manager reports, IEPs, IFSPs in the school settings. I think it's important for you to remember your audience that you are writing the report for. I know that when you are in graduate school, you will learn to write a diagnostic report with very technical terms that is very lengthy. And that's important for you to know how to do that, because in some cases that will be extremely important, that is the type of report you need to write. Sometimes in other settings, not that a school or a medical setting, but sometimes in a medical setting, you may be writing that report for a parent or a caregiver, and in which case it needs to be written so they can understand it. In the school setting, yes, you might be writing it for verification or criteria guidelines. However, you're also writing it for the parent. And so we need to remember our audiences. So watch how much technical language you use. Always use those examples. I think those always make it real for parents, for family members, even for doctors or nurses. It's very important that you do that. And again, in the schools, it's extremely important that IFSPs and IEPs are written for the parents so that the parents can understand them. So remember, when you're writing, whether it's oral, writing any type of report or IEP, whether you are verbally communicating, please remember to use clear and concise communication.